Hello, good morning everyone. My name is Dr. Selva. I'm a consultant obstetrician and gynecologist at Makota Medical Center, Malacca. My area of interest is infertility and laparoscopic surgery. I've been performing IVF in this hospital for the last 23 years. Today, I'm going to talk to you all about fibroid and a new way of treating fibroids. Now, the first question is, what is fibroids? Now, fibroids are the commonest tumor in a woman. Fibroids are so common that it is about 20% of women will have fibroids. Now, many people confuse fibroid with cyst. A cyst is actually a growth in the ovary. It usually contains water, whereas a fibroid is a solid growth in the uterus. It is firm because it contains muscle tissue and fibrous tissue. Now, it is said that almost 80% of women, by the time they reach menopause, will have fibroids. So it's actually a very common condition. Its risk of becoming cancer is actually very low. It's less than 1%. Now, let's look at what are the different types of fibroids. There are many different types of fibroid. It depends on where it is located. Now, if the fibroid is located on the surface of the uterus, then we call it a subserous fibroid. If it is located at like a stalk, as you can see in this diagram, like a stalk, then it's called a pedunculated fibroid. If it is found in the middle of the fibroid, we call it an intramural fibroid. If it is found next to the inner lining of the uterus, that is the endometrium, then we call that a submucous fibroid. Sometimes the fibroid can be pedunculated in the center of the uterus. So depending on where the fibroid is, the symptoms will differ. Now, let's look at what are the symptoms of fibroids. Now, many women have fibroids, but they don't have any symptoms. They only discover it when they go and see a doctor and the doctor says you have a fibroid. Some women may feel a mass in the lower abdomen. So when they feel like there's something there, and then they come to see us and we tell them that there is a fibroid without any symptoms. But some women may have very bad symptoms. The biggest symptoms is actually heavy periods. Heavy periods occur when the fibroid is in the center of the uterus or near the center of the uterus, which we call as a submucous fibroid. Now, other symptoms are that the patient may have pain during periods, or sometimes all the time. Some patients may have difficulty in getting pregnant. So when they are investigated, the doctor will say that they have fibroids. And sometimes the fibroids are the ones that cause them not to get pregnant. Other symptoms are what we call as pressure symptoms. When the fibroid presses on the urinary bladder, like you see in this diagram, then what happens is that the patient will want to go and pass urine all the time. And this is a symptom that when the fibroid is pressing on the bladder. Sometimes the fibroid presses on the tube that runs from the bladder to outside. We call it the urethra. And suddenly they couldn't pass urine. So this can be a symptom. Another symptom is that if the fibroid presses on the rectum, then the patient may have difficulty in passing motion and have constipation, as is shown in this diagram. Another symptom is that if the fibroid presses on the ureter, which is the tube that runs from the kidney to the bladder, then the kidney can get swollen and the ureter can get swollen, and the kidney can get into problem. So this is another symptom of fibroids. Now, what are the treatment options we have for fibroids? Now, generally, if the fibroid is not causing any problem and they are small, we leave it alone. Okay, so what we do, we ask the patient to do is ask them to come once every 6 months to 12 months to monitor the fibroid and see whether it is growing. If it remains the same or it's not growing very fast, we ask to leave it alone. However, if the patient develops symptoms, then we need to undergo surgery. There are two different types of surgery that we can do. The first surgery is called a myomectomy. A myomectomy means we remove the fibroids and repair the uterus. The second is a hysterectomy. Hysterectomy means we remove the uterus. Now, this will depend on the age of the patient and whether the patient wants to get pregnant. And both the surgeries can be done by two methods, either by keyhole surgery, which we call as laparoscopic surgery, or by laparotomy, which means we make a big cut to remove the fibroid. Of course, I would prefer to do it by laparoscopic surgery, which is keyhole surgery. How is it if I can remove or shrink the fibroid without any surgery? That would be interesting, isn't it? That is what we call as HIFU. Now, HIFU, H-I-F-U, stands for High Intensity Focused Ultrasound. Now, what is this technology? Now, if you use a magnifying glass, you can focus a ray of sun onto a piece of paper and burn the paper. In a similar way, we can use transducers to focus a beam of ultrasound into the fibroid and kill off all the cells of the fibroid. And that is what we call as HIFU. So HIFU is focused beam killing the cells of the fibroid so that the fibroid will die. Now, in order to understand this, I'm going to show you all a video. The video will last for about 4 minutes. It will explain all the principles of how HIFU is performed. Now, let's play the video. Okay, this is the first video. The orange bin is the one that produces the sound waves, and it focuses on the plastic, and the plastic is being burned. But as you can see, they put the hand around it, and the hands are not affected. So this shows the safety of HIFU treatment. Now, the next video shows how HIFU is performed in an ox liver. They have written this word Zhongguo, which is China in Mandarin, and we are using this HIFU machine to draw lines on that word Zhongguo. And you can see that with the machine, it is burning these lines, and you can see that once you cut this ox liver, the word is actually engraved into the center of the liver, indicating that it only burns the area we want to burn. So it's very, very specific. So let's look at this video. This video shows how HIFU works in treating fibroids.
An ultrasound beam can be brought to a tight focus at a distance from its source, with sufficient energy concentrated within the focus. The cells lying within will be killed without damaging the surrounding tissues. High-intensity focus ultrasound, HIFU, is, therefore, a non-invasive method of producing selective and trackless destruction of deeply seated tissue targets within the body, without causing any damage to the overlying surrounding tissues. Ultrasound-guided HIFU involves HIFU ablation under the guidance of real-time ultrasound imaging, which can achieve an uninterrupted visualization of tissue coagulative necrosis during the treatment via grayscale changes in real time. The ablated lesions demonstrate an echogenicity or grayscale changes in the ultrasound images after the sonication, which enables immediate assessment of patient's response to ablation, ensuring a safer and more controllable therapy. Imaging fusion and three-dimension digital reconstruction function provide doctors with a much clearer vision during the whole procedure. Thus, doctors can finish the treatment with an ease. Ultrasound-guided HIFU, a new option for the gynecologist to manage uterine fibroids and other gynecological benign tumors, can maximally preserving the integrity of the uterus. No surgery, no bleeding, and no anesthesia. Patients can even chat with doctors during treatment to ease their tension. Patients can go home in nearly 2 hours after the treatment and resume normal life the second day after treatment. Post-operative MRI may still detect the presence of ablated lesions. However, vascularity is now absent in the ablated region, as the ablated lesions will gradually shrink or even disappear over time. The symptoms will also be gradually alleviated or eliminated. Ultrasound-guided HIFU for gynecologists.
Okay, I think the video explains clearly the technology behind how HIFU works. Now, there are many benefits or advantages of performing HIFU. You have seen that HIFU is actually not done under general anesthesia, but it is done under sedation. So this is a big advantage. And actually, when we are performing HIFU, the patient can actually talk to the doctor while the treatment is done. There is also minimal post-operative pain. The patient feels very little pain during and after the surgery. The biggest advantage is also that there is no scar on the abdomen. And more importantly, there is no scar in the uterus. This procedure is actually done in a day care surgery. That means the patient can be admitted in the morning, we do the surgery, and 2 to 6 hours later after resting, the patient can go back. For insurance purposes, we may have to keep them overnight. Usually, this fibroid is done at one session only. But if there are many fibroids or the fibroid is very large, it may require a second treatment. The patient actually can go back to work faster. We usually tell them to rest for 2 or 3 days and then they can go back to work. Now, one of the biggest advantages is that nowadays patients don't want removal of the uterus or hysterectomy, and this particular technique will allow the patient to keep her uterus with the fibroid shrinking. Now, I am an infertility specialist. Now, my main area of interest is actually to help women to get pregnant. Sometimes a patient may have a fibroid and may not be very big to be done by surgery. So this will help to shrink the fibroid so that the patient can get pregnant. Another big advantage is that because the patient's uterus is not cut, the patient can get pregnant faster. Within 3 or 4 months, she can start trying to get pregnant, as opposed to if she does surgery. So if you do a surgery, you make a cut on the uterus and then you stitch the uterus up. You need to rest the uterus for about 6 to 8 months before the patient can get pregnant. And even then, if the patient gets pregnant, we are worried that the uterus may rupture during pregnancy. This is rare, but this can also happen. Now, the last advantage is that fibroids can always occur. We can do a surgery now and it can come back in a few months, in a few years' time. Whereas if we perform HIFU, we can repeat the HIFU if the fibroid comes back. So if you have a fibroid, and if your doctor says, let's do surgery, you may want to consider HIFU as an alternative form of treatment. Now, during this COVID-19 pandemic, many women are afraid to undergo surgery. So this may be a good option for them instead of doing surgery. Now, if you want more information, you can give us a call. You can get more information about HIFU from our HIFU Facebook page. It is called HIFU Melaka. Or you can go to our webpage, www.melakafertility.com, and you can get more information about this. So this is my sharing. If there is any questions, I'll be willing to answer. Thank you. Okay, let me look at some of the questions that are here. Okay, the first question is, can HIFU be used to treat all types of fibroids? Now, the problem is that not all fibroids can be treated by HIFU. The reason is that some fibroids are what we call as vascular fibroids. When a fibroid has got a lot of blood flowing into it, then it may be difficult to be treated with HIFU, because when we shine a HIFU beam into the fibroid, the heat gets dissipated by the high vascularity, so it may not work. So what we usually do is we do a MRI, and based on the MRI, we decide whether the HIFU can be done for the particular fibroid. And in our experience, more than 90% of the fibroids can be treated by HIFU. Now, the next question is, how effective is HIFU treatment for fibroid? Now, there are many studies that have been performed for fibroids. There are almost, I think, 100,000 cases that has been done with HIFU, and its effectiveness is almost 80%. I'm not saying that 100% effective, but there's an 80% chance, that 80 to almost 90% chance that the fibroid will shrink after the treatment. So it's got a very high effective rate, and it has been used in many countries in the world. Okay, somebody has asked me a Malay question: is myom the same as fibroid? Can you do? Yes. In Malay, fibroid is called myoma or myom. Yes, fibroid is myom, and myom can be done with HIFU. So the next question, always people would like to ask is, what is the cost? Okay, unfortunately, this machine is a very expensive machine, and so we have to charge a little bit to do this procedure. But what we are going to charge is about the same or slightly low than what we will charge for a laparoscopic myomectomy. I will not say the cost here because that might not be right. You can call us to get the information, and we will let you know. But it will be not more than the cost of performing a laparoscopic myomectomy. Okay, another question is, will it be covered by insurance? I mean, this is a very popular question. Now, over the last 1 year, I've spoken to almost all the insurance companies. I've also got approval from the Ministry of Health. The Ministry of Health, the HTA, which is the technical committee, has actually approved it for the use of fibroids and adenomyosis. And they also have given me the code for the charges for fibroid. So, and most of the insurance company has given me verbally that it will be covered. So I'm sure that it will be covered by insurance. I'm also sure that it will be covered by insurance because the neighboring countries where this fibroid treatment is being done with HIFU is being covered. For example, Singapore, it is covered. Korea, Taiwan, all these countries where HIFU is done, it is covered by insurance. Okay, the next question is, can HIFU treat other diseases? Now, I'm a gynecologist, so I'm only talking to you all about using HIFU to treat fibroids. We can use HIFU to treat adenomyosis. That is another difficult disease. Now, adenomyosis is different from fibroids. People get confused. Adenomyosis is actually endometriosis within the muscle of the uterus. So we can use this treatment to treat adenomyosis. And adenomyosis is a very difficult disease because we cannot do surgery to remove adenomyosis. So I am very excited that we will be able to use HIFU to kill off this adenomyosis, and then the patient will be able to have less pain and also will be able to conceive. So this is another area of my interest in, especially in infertility. Okay, let me look at other questions. Okay, another question that is asked is there a difference between MRI-based HIFU and ultrasound-based HIFU? I mean, you may not know this. I didn't tell it in the lecture, that there is an entity called MRI-based HIFU. Now, this MRI-based HIFU is actually available in University Malaya and also in USM for the last 10 years. Now, what is MRI-based HIFU? It is basically using HIFU, which is high-intensity focused ultrasound, to kill the fibroid, but we use MRI to image the fibroid. Now, the advantage of MRI-based HIFU is MRI is actually clearer than ultrasound. The disadvantage is that MRI is not real time, which means that when we shoot the HIFU into the fibroid and then do the MRI, it is after shooting that we can see. Whereas in ultrasound-based HIFU, it's real time. We can actually see the fibroid being killed, the cells being killed while performing the ultrasound. So this is a difference. Another big disadvantage of MRI-based HIFU is that the machine is very expensive and it takes a very long time. I've actually one patient who have undergone this MRI-based HIFU for adenomyosis, and it took 6 to 7 hours to do the surgery. And she said she will never do it again because you'll be lying down there for that long a procedure and you're actually awake. Whereas ultrasound-based HIFU, we can do it in 1 to 2 hours, maximum 3 hours. So it's a much more patient-friendly procedure. and that's the reason why we want to bring this facility into Malaysia. Okay, let me see any other questions. Okay, another interesting question that someone has asked is, what about leiomyosarcoma? Now, leiomyosarcoma is actually cancer of the fibroid. Now, one of the biggest problems is that we cannot diagnose leiomyosarcoma by ultrasound, by MRI. MRI, we may suspect. Now, when we do an MRI, it's the reason why we do MRI before doing HIFU for fibroid. If you perform an MRI, if you perform an MRI and you suspect that it's a leiomyosarcoma, then we will not do HIFU. But suppose we didn't suspect and we did the HIFU, then we will follow up the patient. If the fibroid doesn't shrink and keeps growing, or it will, then we are worried about leiomyosarcoma. Then we will have to do a surgery to remove the uterus. So this is one of the worries. But I presume that over the 100,000 cases that we have done over the last 10 to 15 years, there may have been 1 or 2 small leiomyosarcoma were actually killed and left behind. So actually there is a benefit because we are not opening up the uterus. So probably if it's an undiagnosed leiomyosarcoma, it will get killed by this HIFU treatment. So I think that is the last question, and I thank you all for watching this Facebook Live. If you have any questions, you can email me or write to us, and we will give answers to that question. If you want more updates as to when we are going to start these services, please go to Facebook page HIFU Malacca, and I will update you all on our renovation and our installation and our approval for treatment. And we suspect that we hope that we can start the treatment probably in August or September this year. Thank you very much.